all of the research on stem cell therapy, not all of it, 99% is looking at curing diabetes. If we can cure diabetes with stem cell therapy, then of course we can cure hyperinsulinism, because we just take out the pancreas that's causing too much insulin secretion and then do stem cell therapy to cure their diabetes. So I think the fact that the work is being done in diabetes is excellent and will really help. There have been some different studies done looking at stem cells harvested from the placenta and stem cells that have been harvested from teeth. So these are called adult stem cells, as well as fetal stem cell research. And there's loads of stem cell research being done in animals, particularly mice. So it's encouraging. Next question.
Do you know any adults with HI in Finland?
Yes. Next question.
that was what. Okay, I have.
There are lots of adults with HI in Finland, and in fact,
and I think it's either Finland or she says, is Switzerland the same as Finland? I'm sorry, I don't know my countries. Okay, it's my bad. It might be Switzerland because I wrote it down wrong, and she doesn't know any adult HI families, and she is in Switzerland. I'm sorry.
So the question is, do we know of any HI families in Switzerland? So the answer is, I don't know of any, and I don't know of any HI doctors in Switzerland, but there are excellent endocrinologists in Switzerland, and even though Switzerland is a small country, there are almost certainly going to be a couple of babies a year there, and so there probably are some adults.
Okay.
So the best thing to do would be to find the biggest academic center, I think it might be in Lucerne, and talk to the endocrinologist there. Primarily the pediatric endocrinologists, because there are very few adult endocrinologists who understand anything about hyperinsulinism, even though it happens to adults.
Okay. Adam wants to know also, with this new medicine, what are the side effects that will come with them, and what are they? If the side effects won't be too bad, how long before it will be available to parents?
So with any medicine that's developed, it generally takes 7 to 10 years to go from the very first studies in humans to being available for use, because the FDA has got all these regulations. So Dr. De Leon in Philadelphia is working on a drug that just got orphan drug status, was approved, which is a great help because it fast tracks the drug. What it does is it allows all of the studies to be done on smaller numbers of children or adults. It lowers the cost to the pharmaceutical industry to get the drug developed, because it costs a lot of money to submit a drug through the FDA, so they lower their costs for drugs that are used to treat rare diseases. That's what we call an orphan drug. But it still takes many, many years. So you're talking 7 to 10 years. 7 years would be a fast drug.
Okay. Is there a link between SIDS and possibly HI kids? Have any Okay.
So the question is could there be a link between the sudden infant death syndrome and hyperinsulinism?
Yes.
And the answer is there probably are some children who don't get diagnosed, and the first thing that they knew is that the baby had a hypoglycemic reaction in the middle of the night and died. However, when you look at the vast majority of children who die of SIDS, they do look at their blood glucoses. That's part of the protocol. And they actually measure it from the fluid in the eye. And the vast majority of children who die of SIDS do not have low blood sugars.
Okay.
In fact, so every few years, as we look at all the babies who die of sudden infant death syndrome, we find a subset of diseases that causes it. We learn about that and we treat them and they do better. So for example, the last big set of disorders that we discovered were causing sudden infant death syndrome was the fatty acid oxidation defects, or MCAD, medium chain acyl-CoA dehydrogenase defect. And so what they found is that kids would get mild intercurrent illnesses, and they'd have 25% of patients with MCAD die the first time they get sick. And so probably these fatty acid oxidation defects were the last sort of treatable, diagnosable disorders that we found in the group of illnesses that we call SIDS.